Hello, this is Dr. Grande. Today the question is, what is antisocial personality disorder? Now, antisocial personality disorder is a mental health disorder that has been made popular in the movies and in television, and there's a lot of misinformation and misunderstanding about this disorder. There are a lot of criteria for antisocial personality disorder, and a certain number of these criteria the individual would have to have met since the age of 15. Now, what's unusual about this is that the diagnosis of antisocial personality disorder cannot be given to someone until they're 18 years old. So taking a look at the symptom criteria for antisocial personality disorder, first we have repeated acts that violate the social norms, that violate the norms of society. And these acts would be grounds for arrest. Many individuals with antisocial personality disorder have been arrested and incarcerated. Next symptom criterion is deceitfulness, lying. This is fairly common with this disorder. We also see impulsivity, irritability, and aggressiveness, including physical aggressiveness in many cases. A reckless disregard for the safety of others. Irresponsibility, and this can be across one dimension or many dimensions. Work irresponsibility, financial irresponsibility. And we see no remorse. So many individuals with antisocial personality disorder, when they commit an act that harms other people, they don't feel remorse. A lot of times they tend to blame the victim or imply that the victim deserved whatever was done. So we see a real lack of empathy. So as I mentioned, we see a lot about antisocial personality disorder in the movies and in television. And oftentimes they look at extreme characterizations of this illness, including people that commit acts of extreme violence or extremely sophisticated types of criminal activity, like organized crime. However, a lot of the criminal activity we see in real life in mental health treatment would be more like fraud, more like manipulation and theft crimes. Certainly, more serious crimes are committed by many individuals with this disorder, but the majority of crimes we see are more based on manipulation and theft than they are in some sort of physical aggressiveness and harming people. However, of course, there are, as I mentioned, a number of people with antisocial personality disorder that do commit severe crimes, and this becomes an issue for treatment professionals. A fair number of mental health treatment professionals, understandably, prefer to avoid treating antisocial personality disorder. There's the personal risk and the risk to people at the facility, but also there's this idea that antisocial personality disorder is extremely difficult to treat. Add on top of this the kind of charming demeanor and the manipulation piece we see with a lot of people that have this disorder, and it only makes it more difficult to provide treatment. Now, with the prison population, with those that are involved in the criminal justice system, there are a few characteristics that we tend to see more often in those individuals. And that would be a lack of empathy, superficial charm, and an inflated self-appraisal. So those three characteristics we tend to see more with individuals involved in the prison system. Now, what causes antisocial personality disorder? We don't know. We do know there is a genetic component. We don't know what kind of contribution that makes in terms of a percent. There's no real precision there. But there is a biological component, and there are environmental components. There have been a number of events that have been connected to antisocial personality disorder, but we really don't know if they're causal. One would be malnutrition, another smoking during pregnancy. Another risk factor would be having one or both parents that have a substance use disorder. But the big one that we see repeatedly tends to be related to trauma. Child abuse seems to contribute to the development of antisocial personality disorder. Again, we can't be sure, but we believe that may be causal. Certainly there's an association between child abuse and other early childhood trauma and the development of antisocial personality disorder. So in the general population, about 3% of males have antisocial personality disorder and 1% of females. When we look to other populations, like those being treated in long-term substance use care facilities or those incarcerated, the percentages go up dramatically. For males, some studies show as high as 70% of individuals from those settings could have antisocial personality disorder. And specifically looking at prisons, there are some studies that show up to 80% of males in prison could be diagnosed with antisocial personality disorder. When looking at comorbidity for antisocial personality disorder, that is, other mental health disorders that tend to occur with this disorder. This disorder has high comorbidity with a number of mental health disorders. It's estimated that over 80% of individuals with antisocial personality disorder have a comorbid substance use disorder. About 50% have a comorbid anxiety disorder, and around 25% a comorbid depressive disorder. Another question I get fairly often related to antisocial personality disorder is, how is it related to psychopathy and sociopathy? So just to give a summary, we view psychopathy and sociopathy a little differently. You can think of psychopathy as more biologically based, and sociopathy is more environmentally based. And when we think of some of the key traits associated with psychopathy versus sociopathy, we would think of psychopathy as inherited, so it's genetic, as I mentioned, and individuals with psychopathy would be more cold and calculating and less emotional than somebody with sociopathy. So they would still oftentimes commit crimes and violate social norms, but they would think through the consequences a little more. And there's also this belief that somebody with psychopathy generally is at a greater risk to commit severe crimes. Now with sociopathy, somebody with sociopathy is more emotional. They have more mood dysregulation, and they tend to be more impulsive. They don't think through to the consequences. We think of individuals with sociopathy, we think of them as more likely to commit less severe crimes and to get caught more often for the crimes they do commit because of the lack of planning. So more impulsive, less planning, and we think of it as being caused more by environmental aspects. So somebody with sociopathy would appear to have more problems with mood management than somebody with psychopathy. Also, we think of individuals with sociopathy as being less charming, less manipulative. Now, the distinction between sociopathy and psychopathy may be interesting and certainly plays a part in how we conceptualize antisocial personality disorder, but both psychopathy and sociopathy point towards antisocial personality disorder. So somebody with antisocial personality disorder would likely have sociopathic tendencies or psychopathic tendencies. It doesn't affect the diagnosis. Sociopathy or psychopathy has no effect on whether somebody has antisocial personality disorder. The official mental health disorder and the Diagnostic and Statistical Manual, the DSM, is antisocial personality disorder. You could think of psychopathy and sociopathy as two sets of characteristics that appear to be distinct, but it has no bearing on the mental health disorder. I hope you found this description of antisocial personality disorder to be interesting. Thanks for watching.